If your gums bleed, listen up because bleeding gums is not normal. Healthy gums should never bleed when you're brushing or flossing. If they do, we need to first figure out why. There are usually two different reasons that can cause bleeding gums. One is gingivitis or periodontal disease, and the other is a systemic health condition. I can't even count the number of times patients have said to me, "Oh, my gums bleed, but no worries, it's normal." If your hand was bleeding, you wouldn't just casually mention to your doctor, "Oh, by the way, my hand just bleeds all the time, it's normal." It's the same with your gums. They should not be bleeding. So I always tell my patients first, let's figure out why they are bleeding, and then we'll figure out how to stop them from bleeding. Some people's gums only bleed when they floss their teeth, but people with more inflamed gums might see bleeding every time they brush their teeth. The most common reason for bleeding gums is simply from poor home care, not keeping your teeth clean enough. When plaque starts to build up on your teeth, your body sees that plaque bacteria that shouldn't be there. And if that plaque is hanging out on your teeth for too long, your immune system starts rushing antibodies, which are in your bloodstream, directly to your gums. So proper brushing techniques and proper flossing techniques are critical in preventing bleeding gums. If it's been a while since you've properly stimulated your gums, then it's probably just a matter of time before your gums start to bleed. So truly make sure you are brushing and flossing properly. It's like working out, like daily. The more you work out, the less it hurts. Same idea with your gums. The more you stimulate the gums properly through brushing and flossing, the less tenderness you will feel. So always make sure you are using the proper techniques. I have videos on proper techniques for brushing, flossing, water flossing, interdental brushing, and I will link those videos below in the bottom bar. Keep in mind, if your gums are bleeding, the first thing you should do before anything is make an appointment with your dentist and get a professional cleaning. During your appointment, ask your dentist or your dental hygienist what they recommend for you. For example, there are some patients I feel need to use an electric toothbrush. And there are others who I don't care what toothbrush they are using, but I need them to use a water flosser in addition to traditional string floss. You know, it's a case-by-case determination on what will best benefit each individual patient, which is decided by the severity of each patient's periodontal charting. So get your recommendations from your dental provider, get your professional cleaning, and then go home and focus on daily routine oral home care. Take time to brush. Everyone needs to brush. And then for cleaning in between your teeth, take time to floss, to water floss, to interdental brush, a combination of the three, whichever your dentist or dental hygienist recommends for you, or whichever works best for you. Just know that brushing is not enough. You need to be cleaning between your teeth as well. In the majority of bleeding gums cases, the main cause is gingivitis, which means inflammation of your gums. If your gums are swollen, it's almost like you have a puffy wound like somewhere else on your body. If you were to start touching it or pressing it, it might bleed. But with your gums, they're full of blood vessels. So when they get inflamed, they bleed far easier. How do they get inflamed? Again, this is from plaque bacteria hanging out on your teeth for too long. Gingivitis is reversible. Like I said, with gingivitis, you can go to the dentist, get a professional cleaning, come home, focus on proper daily home care, and then you can bring your gums back to health with no more bleeding and no more inflammation. However, if you do not reverse gingivitis, it can progress into a more advanced stage of periodontal disease, also called gum disease, periodontitis. At this point, those bacteria have snuck their way below your gum line, underneath your gums, which can lead to bone loss, which we do not want because bone is what holds your teeth in place. So it's super important to visit your dentist and find out why your gums are bleeding. If it's gingivitis, work hard at home to keep them clean. If it's periodontitis, also work hard at home to keep them clean and be sure to follow your dental provider's advice. If they feel you should be having more frequent dental cleaning appointments, say every 3 months instead of every 6, it's in your best interest to follow their advice. Now, people with systemic conditions, such as diabetes, for example, are more at risk to develop gum issues, which means there's a greater chance of them having bleeding gums. So if you're wondering why your gums are still bleeding, if you feel like nothing is helping, like you are physically doing the best you can, like visiting your dentist routinely and using proper home care techniques on the daily, it might be worth visiting your physician to confirm that your bleeding gums are not stemming from a systemic condition or a vitamin deficiency. Again, it is much more common that your gums are bleeding from poor dental hygiene. So don't jump to the conclusion that you have diabetes. Always always give it your all with the brushing and flossing at home, and then go from there. Lastly, just remember, once you start your new proper home care routine, it might take your gums a couple weeks to stop bleeding, so don't get discouraged. But usually once you complete a full 2 weeks of really good hygiene, you can effectively stop your gums from bleeding. Again, remember that you need to visit your dentist first for them to remove any hardened plaque, also known as tartar, because if there is tartar present in your mouth, you can brush and brush and brush and you can floss until you're blue in the face and it will not come off. You need tartar to be professionally removed. And then you can successfully focus on maintaining clean teeth through proper home care. Pro tip, just be warned, if you're someone who smokes, your mouth might not bleed even if it's infected. So it's especially important for those who smoke or use tobacco to get regular gum exams to make sure there's no periodontal disease hiding out without you knowing about it. Just another reason to visit your dentist routinely. Thank you all for watching. I hope this video helped you. Please like and subscribe if it did, and don't forget to visit my website, teethtalkgirl.com, where you can learn more about healthy gums and healthy teeth. It also has a search bar so you can search for a specific video topic and find it easily. Peace, love, and teeth.